Okay, so patient asked, is rheumatoid factor being positive evidence that she has rheumatoid arthritis, right? So my name is Dr. Rheumatoid Dada. I help people with joint pain become pain-free, people with autoimmune disease get their immune system back on track. So question was, if I have positive rheumatoid factor, does it mean that I have rheumatoid arthritis? And the answer is a resounding no. Okay, and this is why. Rheumatoid factor is not a very reliable test. Very common in women. If you have any kind of chronic disease, if you have a viral infection, you could have a positive rheumatoid factor. What makes that rheumatoid factor actually worth reviewing is there's a second test called anti-CCP antibody. So Coke Peter, antibody. So if you have a positive rheumatoid factor and a positive anti-CCP antibodies, the presence of both of those dramatically increase your risk of developing rheumatoid arthritis to like 95-96%. So it means that if you have a positive rheumatoid factor and CCP antibody, your risk for developing it is sky high, and it is most likely that at some point in your life you will develop rheumatoid arthritis. The good news is that it is not an absolute test, and it doesn't mean that you have the condition right this second. So what you do is you talk to your primary care doctor, you talk to your rheumatologist and say, hey, I have these two tests that are positive. It does mean that my risks are higher. What are the things that I could do? So let's talk about 3 easy things that you could do when you have those two tests, because your risks are very high. So it means that 1, you don't do things that are going to provoke rheumatoid arthritis. So if you are overweight, right, then you need to lose some weight, because high weight, or I didn't want to say the word obesity, but obesity has been associated with an increased risk for rheumatoid arthritis. So we need to watch the weight, and you watch the weight by good old diet and good old exercise. But diet is more important than exercise. I'm finding out in my old age. Okay, so 1. 2, you don't smoke. If you are smoking, quit. You just have to quit. There are multiple ways in which you can quit. I know I'm saying it sounds easier said than done, yes, but you can do it. Right? You did hard things. You used to crawl, now you walk. So now you run. So you can do very hard things, okay? So quitting smoking, if you're smoking, that would be a big one. And then the foods that we eat, right? Trying to clean out your diet. The Mediterranean diet is the best anti-inflammatory diet. So those are simple things that you can do to lower your risk of developing rheumatoid arthritis. That said, if you have a rheumatoid factor and anti-CCP antibody positive, it doesn't mean you have rheumatoid arthritis right now, and doesn't mean that your doctor will want to treat it right now, unless there is some kind of symptoms that you have rheumatoid arthritis that is active. Otherwise, my recommendation is talk to your doctor. There are medications like hydroxychloroquine, which we feel that reduces the risk of developing a full-blown episode of rheumatoid arthritis. So hydroxychloroquine is something that we feel very comfortable with, very low side effects. You get to check your eyes once a year. So anyway, I hope this was helpful and tells you that if you have a rheumatoid factor, do not panic. Okay, because it could just be a false positive. Rheumatoid factor is very common in women, and it can come and go with infections and a whole bunch of other things. Okay, so if this video has been helpful, follow us on Healthy Joints, Healthy Life. Like this video, share it, and my name is Dr. Rheumatoid Dada. Come see us if you are in the Pacific Northwest, and take good care.